Let's talk about blackheads. They aren't dirt, but a mix of oil and dead skin cells that oxidizes and turns dark. Aggressive squeezing leads to irritation and scarring, so today we'll clear them gently. Welcome to my BREHETM method, a routine that's satisfying to watch and safe for your skin. Here's our roadmap. The BREHETM method. We'll begin warm to soften, remove oil, exfoliate smart, activate a detox, perform a targeted release, hush inflammation, and build an everyday shield to maintain clear skin. B. Begin warm, soften, don't scald. First, create a warm, humid environment. Press a clean, warm face cloth against your T-zone for 2 to 3 minutes, or use a facial steamer. The goal is to soften the hardened sebum plugs. A quick myth bust: heat doesn't open pores. It melts the waxy contents inside them, making them pliable so they require less force to remove. If you're wearing makeup or heavy sunscreen, do a quick pre-cleanse with micellar water to let the warmth penetrate effectively. R. Remove oil, the 60-60 double cleanse. Now for our 60-60 double cleanse. First, use an oil-based cleanser on dry skin for 60 seconds. The oil binds to sebum and makeup, dissolving it. Focus on congested areas like the nose, sides, tip, and chin. Then, add water to emulsify the oil into a milky liquid before rinsing. For the second 60-second cleanse, use a water-based gel or foam cleanser. A low-concentration salicylic acid cleanser is great if your skin tolerates it. If not, choose a gentle one with calming ingredients. This second step removes any remaining residue. After rinsing, your fingertips should glide smoothly over your skin. If it feels tight or squeaky, your cleanser is too harsh, which can ironically lead to more oil and congestion. E. Exfoliate smart. MAP, don't blanket. Smart exfoliation means treating zones based on their needs. For your blackhead MAP, usually the nose, its sides, and chin, use a low-strength BHA liquid, around 0.5 to 1% salicylic acid. Apply it with a cotton pad using a gentle press and hold motion, not rubbing. Do this 2 to 4 times a week, only in the evening. For sensitive zones like your cheeks, use a gentler exfoliant like PHAs, LHAs, or mild lactic acid, 1 to 3 times a week. A crucial rule: always skip strong acids on nights you use a retinoid to avoid overexfoliation. And please, retire gritty physical scrubs. They can cause micro tears and inflammation. A. Activate detox, enzyme plus clay pulse. Once or twice a week, boost your routine. First, an enzyme mini cleanse. Add a pinch of powder enzyme, like papaya, into your foaming cleanser and massage for 45 seconds. The enzymes dissolve the glue holding dead skin cells together. Next, apply a thin layer of a clay mask just to your T-zone. Kaolin is gentler, bentonite is great for oil. Rinse it off after 6 to 8 minutes when it's about 80% dry. Letting it crack fully will dehydrate your skin. T. Targeted release. ASMR peak, ready only. After all this prep, some plugs will be ready. The only eligible candidates are raised, open blackheads, or soft, visible whiteheads. If it's deep red or under the skin, it is not ready. Hygiene is non-negotiable. Sanitize your metal loop tool with 70% isopropyl alcohol. If using fingers, they must be clean and wrapped in tissue. For blackheads, use the lift and roll technique. Gently stretch the skin, place the loop slightly past the blackhead, apply very light pressure, and roll it back over the pore. The contents should glide out. For soft whiteheads, use the Q-tip cross-compress method. Place 2 swabs on either side at a 45-degree angle. Gently press down and roll upwards. Never pinch. Adhere to the rule of 2s. If it doesn't release after 2 gentle attempts, stop. Forcing it causes damage. Never attempt to extract deep cysts, milia, or ingrown hairs at home. See a professional. Immediately after, perform post-pop microcare. Sweep with saline solution, apply a micro dab of salicylic acid, then cover with a hydrocolloid patch overnight. H. Hush inflammation, right after. Now we calm everything down. Generously mist or press in a soothing toner with ingredients like Centella asiatica, heartleaf, or panthenol to reduce redness. Next, glide a wrapped ice roller over the areas for 30 to 45 seconds. The cold helps constrict blood vessels, immediately calming redness and swelling. E. Everyday shield and schedule, keep it clear. To maintain results, consistency is key. In your daily routine, use just one thin, targeted active serum before your moisturizer. For excess shine, a 4 to 5% niacinamide serum on the T-zone is excellent for regulating sebum. For red or dark marks, a thin veil of azelaic acid on those spots will help fade them. Always seal in serums with a lightweight, non-comedogenic gel moisturizer with ingredients like ceramides and hyaluronic acid. And the most critical morning step, a broad-spectrum, non-comedogenic sunscreen with at least SPF 30. UV exposure makes blackheads appear darker. A smart night rotation is key. On night A, use your BHA on target zones. On night B, use a pea-sized amount of a retinoid like adapalene for your whole face to regulate cell turnover. And night C is for recovery. No actives, just cleanse, hydrate, and moisturize. Finally, don't underestimate micro-habits. Change your pillowcase often. Wipe your phone screen daily. Cleanse after workouts. Wash makeup brushes weekly, and keep your hands off your face. On the same day, you'll notice calmer skin and less shine. After a week, you'll feel a smoother texture. And within 4 weeks, you should see a significant drop in the blackhead cycle. This is about progress, not perfection. I'd love to help you personalize this. Comment with your skin type and toughest zone, and I'll pin a comment with a tailored mini-map for you. Drop an emoji if you're inspired to try this method. Please like, share, and subscribe for more gentle, effective routines.